For me, I'm seeing patients a lot further down the line when they're back in general practice for their ongoing maintenance and care. And I think that's where I met a couple of patients that had gone through head and neck cancer treatment. It's where I became acutely aware of the discord between medicine and dentistry, meaning these people didn't have the provision that they really needed to keep them healthy. And we know that when these people suffer tooth decay and gum disease, it can affect their dentures, their prosthesis, their reconstruction. So then it can often mean that there's other things that happen later down the line that could have possibly been avoided had there been better and more efficient care in general dental practice. I think there's a lot of focus for dental professionals on identifying head and neck cancer patients. So we know what to look out for in terms of red and white lumps in the mouth, dry mouth, hoarseness, changing of the voice, that sort of thing. But I don't think there's enough education around the treatment and then around the late effects when they come back. The treatment tends to be in a hospital setting, so we don't have much to do with that in terms of general dentistry. But later down the line, when they're back with us, I think there needs to be more education around that. And coming and speaking to people and sharing our experiences with patients and with other clinicians can go a long way in helping to provide that level of care. So some of my advice for practitioners working with people that have gone through head and neck cancer therapies is to do things like wetting the instruments before you put them in, the handles and the ends, if you're able to. Just so the mirror in particular, if you're using that to hold someone's cheek out of the way, if it's nice and wet before you start, it means it's not going to get stuck to that soft tissue. Using lots of Vaseline around the lips as well, again, just help things move as you're treating someone. And cotton wool rolls are probably my best friend in terms of treating someone, because if you soak them before you start and leave them on the side, then if things are starting to dry up, for example the gums, the teeth, the tongue, the soft tissues on the inside, you can wipe that cotton wool roll round the teeth and the soft tissues and help to lubricate everything and stop anything getting stuck or caught on that as you're going around the mouth. I just think it's a really, really important place that people can come together to learn more about how to interact with these patients, how best to treat them, bring lots of different people together, treat patients, clinicians, carers, other people that are involved in the treatment pathway. I think a really, really powerful thing I've taken from today is listening to patient stories, because that goes a long way. You go into healthcare because you want to help people, and it keeps informing you of the need to keep helping people and what we can do more in terms of patient advocacy. For example, medicine and dentistry don't talk very well to each other. As I said, head and neck cancer patients can very much be on like the knife edge between the two. So trying to create better multidisciplinary teams across general practice as well as in hospital is really important, and becoming more aware of the late effects of head and neck cancer as well, because I think there's a lot of things that we can be battling years and years down the line when someone's a more general practice patient that maybe we've not come across before.